This is Dr. Kehinde, and he is one of the thousands of Nigerian trained doctors who have migrated to the UK to work in the country's medical system.
Shortly before I left Nigeria, I was a registrar in trauma orthopedics at Iroa Specialist Teaching Hospital in Edo State. And I was in my third year of training before I decided to move down to the UK.
10 years ago, junior doctors in Nigeria earned around $1,000 a month. But since then, the currency has suffered a severe devaluation. And now many doctors take home half of that, only $500 a month. So there's now a mass exodus of health personnel leaving Nigeria and leaving the country's health system in a bad shape.
I got tired of the system, sincerely. I got tired of having to go back and forth on strikes. Got tired of government promising to improve healthcare delivery in the country, and remunerations were poor, and salaries that were take home could no longer take us home.
It isn't just money that is driving the health migration. Many are after international medical experience, as well as what they describe as a better life. The UK is no stranger to migrant medical staff. This pattern has occurred for several decades. In the 1950s, nurses from the Caribbean were given incentives to come to work in Britain. Alamide, a nurse from Nigeria, decided to take a similar leap 5 months ago.
I believe that the training we get in Nigeria is superb, and basically when you come into the UK, you're just trying to learn the new policies, the policies of your trust, the policies of your workplace, how they do things, and just basically the equipment they use. The mass migration of nurses, as you said, from the continent of Africa, from Nigeria, Ghana, Zimbabwe. We have, in the few months I've been practicing in the UK, I've met nurses from all over the world.
The Nigerian Medical Council estimates that over 9,000 of its doctors have left to work in hospitals across Europe. But it's not just Nigerian-trained doctors making the swap. This economic migration spans across the entire medical field. This year alone, the UK Home Office recorded an increase of 29,000 visa applications between 2021 and 2022. The mass migration of health professionals is happening across Africa, with the UK being a hotspot for this type of recruitment.
One major factor is because people just want better for themselves, better in terms of better pay, better opportunities for career advancement. In the few years I practiced in Nigeria, I've seen healthcare workers sometimes have to contribute to food patients' bills.
And with more medical professionals queuing to leave Nigeria and the continent, the future of medical care still looks bleak. Lape Alarinoye, Africa Matters.